Let me be completely straight with you about something. If you've searched how to grow your hairline fast, you've probably already waded through a swamp of castor oil tutorials, rosemary water recipes, and scalp massages that promise to regrow your edges in 30 days. And I get it, those videos are everywhere and they are easy to believe when you're desperate. Here's what I'm going to do instead. I'm going to tell you exactly what is happening to your hairline, exactly what the clinical evidence says works, what doesn't, and what gives you the fastest results that are actually real. No oil, no hype, just the facts. First, understand what you are dealing with, because if you don't know what's causing your hairline to recede, you cannot treat it correctly. The most common cause of hairline recession in both men and women is a condition called androgenetic alopecia, or pattern hair loss. It affects an estimated 50 million men and 30 million women in the United States alone. Here's the biology. Your body produces a hormone called dihydrotestosterone, DHT for short. DHT is made when an enzyme called 5-alpha reductase converts testosterone. And here's the problem. If your hair follicles carry a specific genetic sensitivity to DHT, that hormone binds to the follicle and slowly shrinks it. Each hair growth cycle becomes shorter, each new hair comes in thinner and shorter than the last. Eventually, the follicle produces nothing visible at all. That process is called miniaturization. Now here's something I want to correct immediately, because the internet gets this wrong constantly. Your testosterone level is not the villain. DHT sensitivity in genetically vulnerable follicles is the problem. Some men with very high testosterone keep every strand of hair they were born with. Some men with perfectly normal testosterone levels go bald in their 20s. The determining factor is genetic receptor sensitivity, not how high T you are. How common is this? By age 35, roughly 2/3 of men have some degree of noticeable hair loss. By 50, about 85% of men have significantly thinning hair, and 25% of men begin seeing the first signs before age 21. Women are not spared. Female pattern hair loss typically presents differently, not as a receding hairline, but as diffuse thinning across the crown and a whitening center part. It affects roughly 1 in 3 women over the age of 50, and it is dramatically undertreated because it is still socially normalized into invisibility. Here's the most important clinical truth about timing that I need you to hear right now. Once a hair follicle undergoes complete miniaturization and the erector pili muscle detaches, hair loss at that site becomes very likely permanent. The window for reversal and regrowth is open, but it does not stay open forever. This is why fast actually means something medically. Not overnight, not in 2 weeks, but the earlier you act on evidence-based treatment, the more you can save and recover. Before I tell you what works, I'm going to spend 60 seconds on what does not, because you are probably wasting time and money on at least one of these right now. Castor oil and rosemary oil. There is no robust clinical evidence that castor oil regrows hairlines in androgenetic alopecia. Rosemary oil has one small study, 100 participants, suggesting it may perform similarly to 2% minoxidil for scalp hair density. That is mildly interesting. It is not a treatment protocol. Biotin supplements. The International Society of Hair Restoration Surgery states clearly, biotin supplementation does not promote hair growth in the absence of a documented biotin deficiency. Biotin deficiency is extremely rare in people who eat a normal diet. The supplement industry has turned a rare deficiency treatment into a billion-dollar product marketed to people who do not have the deficiency. Worse, excess biotin in your bloodstream can produce dangerously false laboratory results, including false thyroid readings and false hormone tests. So you may be spending money on something that does not work and interferes with your medical testing. Scalp massage alone. No clinical evidence supports scalp massage as a standalone treatment for androgenetic alopecia. It feels good, it is not a medical intervention. Now, what actually works? Treatment 1. Minoxidil, your frontline tool. Minoxidil is FDA-approved for both men and women. It was the first drug ever approved by the FDA specifically to promote hair regrowth, approved in 1988. Here's what it does. It is a vasodilator that increases blood flow to your scalp's hair follicles, prolongs the anagen growth phase of the hair cycle, and stimulates certain growth factors inside the follicle. For men, the 5% topical formulation is your target. In a 48-week, double-blind, placebo-controlled trial of 393 men, 5% minoxidil produced 45% more hair regrowth than the 2% concentration. That is a clinically significant difference, and it is why 5% is now the standard recommendation for men. For women, 5% used once daily is effective. The 2% formulation is the one originally approved for women, but dermatologists now frequently recommend 5% at lower frequency because the evidence is stronger for regrowth. Here is what you absolutely must understand about minoxidil. It must be used indefinitely. If you stop using it, the hair it helped you maintain and regrow will be lost within months. This is not a course of treatment. It is a permanent maintenance commitment. If that is not something you are prepared for, you need to factor that into your decision before you start. You may also experience initial shedding during the first 4 to 8 weeks. This is normal. It is called a telogen shed, older weak hairs being displaced by a new growth cycle being activated. Do not stop using it because of early shedding. That is the most common mistake I see. Results begin to show at 3 to 6 months. Full results may take 9 to 12 months. Manage that expectation clearly. This is not a fast treatment in isolation. That is why I am about to tell you what to combine it with. Treatment 2, Microneedling, the evidence-based accelerator. Microneedling, using a derma roller or derma pen to create controlled micro-injuries on the scalp, is currently one of the most evidence-supported ways to accelerate hairline regrowth. Here's how it works. The micro-injuries activate your body's wound-healing cascade, which releases growth factors including VEGF, vascular endothelial growth factor, and stimulates the WNT beta-catenin signaling pathway. These are the exact pathways involved in hair follicle activation and stem cell stimulation. In a randomized controlled trial of 100 men with androgenetic alopecia, the group combining weekly microneedling with 5% minoxidil was statistically superior to the minoxidil-only group on all 3 primary measures: hair count, patient assessment, and investigator assessment at 12 weeks. And critically, at 8-month follow-up, all participants in the microneedling group still showed durable hair growth. A 2024 meta-analysis of 12 randomized controlled trials involving 631 androgenetic alopecia patients confirmed combined microneedling and minoxidil significantly improves hair count compared to minoxidil alone. In practical terms, one study found that 82% of participants combining microneedling with minoxidil reported hair improvements of more than 50%, compared to just 4.5% using minoxidil alone. And the change in average hair count was 4 times higher in the microneedling group. This combination, minoxidil plus microneedling, is currently the fastest non-surgical evidence-based protocol for hairline regrowth, and it is what I would recommend as your starting point before anything else. Treatment 3. Finasteride, for men only, with full informed consent. Finasteride is an oral FDA-approved medication for male androgenetic alopecia that works by blocking the 5-alpha reductase enzyme, reducing serum DHT levels by approximately 73%. It is the most effective pharmacological intervention for halting male pattern hair loss, and it does promote regrowth, particularly at the crown and frontal scalp. I will not recommend this to you without also telling you what the regulatory agencies are saying right now. In 2025, the European Medicines Agency issued an updated warning on finasteride and dutasteride, requiring clearer labeling around the risk of suicidal ideation and depression. These are real documented side effects that occur in a subset of patients, including persistent sexual dysfunction in some men even after stopping the drug, a condition sometimes referred to as post-finasteride syndrome. I am not telling you this to scare you away from finasteride. It remains a genuinely effective FDA-approved medication that works well for many men without significant side effects. I am telling you because you deserve complete information before you take any medication. This is a conversation to have with your prescribing physician, not a decision made from a YouTube video. Treatment 4. Nutrition. Test first, supplement second. Here is where I need to correct another major piece of misinformation. You do not need to take a hair growth supplement. You need to know whether you have an actual deficiency. The micronutrients with real clinical association to hair loss are iron, vitamin D, and zinc. A 2024 systematic review confirmed that deficiencies in these 3 nutrients are associated with increased risk of androgenetic alopecia and pattern hair loss. If you have low iron, particularly ferritin, hair loss is a documented consequence. This is especially common in women with heavy periods. If your vitamin D is deficient, there's evidence linking that deficiency to accelerated hair follicle cycling problems. Zinc plays a direct role in the hedgehog signaling pathway essential for hair morphogenesis. The correct approach, ask your doctor for a blood panel including ferritin, serum iron, vitamin D25OH, and zinc. If deficiencies are found, correct them. If no deficiency is found, supplementing these nutrients above normal levels has not been shown to produce additional benefit for hair growth. And biotin, despite being marketed relentlessly, is not recommended by the ISHRS or dermatological guidelines as a hair loss supplement, unless you have a documented rare biotinidase deficiency. What you can do through diet: eat adequate protein. Your hair is made of keratin, a protein. Consume fatty fish, eggs, dark leafy greens, legumes, and seeds. These provide the raw materials your follicles need to produce strong hair shafts. That is not glamorous advice. It is accurate advice. Treatment 5. Address stress and sleep. They are not optional. Stress causes a specific, distinct type of hair loss called telogen effluvium. This is different from androgenetic alopecia. Under significant physiological or psychological stress, large numbers of hair follicles are prematurely pushed into the telogen, resting phase, simultaneously. 2 to 4 months later, they all shed at once. This is why major illness, surgery, extreme dieting, trauma, or sustained work stress can produce dramatic, sudden hair shedding. The good news: telogen effluvium is temporary. When the stressor is removed or managed, hair regrowth resumes, typically within 3 to 6 months. The critical management principle is this: if you are experiencing active telogen effluvium and you layer it on top of existing androgenetic alopecia, the combined effect is significant. Managing stress is not a wellness suggestion. It is clinical management of a known hair loss mechanism. Sleep deprivation elevates cortisol chronically. Elevated cortisol disrupts the hair growth cycle and accelerates follicle miniaturization over time. 7 to 9 hours of sleep is not a luxury. For your hairline as for your waistline, it is a biological requirement. Treatment 6. Surgical hair transplant, the only permanent solution for hairline restoration. I would be doing you a disservice if I didn't mention this. A hair transplant, either FUE, follicular unit extraction, or FUT, strip method, is the only permanent solution for hairline restoration. Donor follicles from the back and sides of the scalp, which are genetically resistant to DHT, are transplanted to the recession areas. These follicles retain their DHT resistance at the new location. A transplant does not stop the progression of androgenetic alopecia in the areas of native hair around the transplant. Most hair transplant surgeons recommend maintaining Minoxidil and/or Finasteride alongside a transplant to protect your existing hair. A transplant without ongoing medical treatment may result in the transplanted hairline looking progressively isolated as surrounding native hair continues to recede. A hair transplant is a surgical procedure. It requires the right candidate, the right surgeon, and realistic expectations. It is not appropriate for everyone, and it is not a first-line intervention, but for the right patient at the right stage, it is the most definitive hairline restoration available. I committed to giving you realistic expectations, so here they are. The fastest you will see genuine new hairline growth from a non-surgical medical protocol is approximately 3 months, and that is with Minoxidil combined with microneedling started simultaneously. More commonly, meaningful visible results appear between months 4 and 6. Full result assessment requires 9 to 12 months of consistent treatment. Hair transplant results for the transplanted hair specifically follow the same biological timeline. Transplanted hairs shed in the first 2 to 6 weeks, then regrow beginning at 3 to 4 months, with near final results visible at 9 to 12 months. Fast in the context of hairline restoration means faster than the natural progression of loss, not weeks from now. The fastest path is to start the right protocol today and be consistent. Every month of delay is follicular miniaturization that may or may not be reversible. Right now, here is exactly what I need you to do. First, book a dermatology appointment. I mean this week. Androgenetic alopecia is a progressive condition. Every month without treatment is a month of continued follicle miniaturization. A dermatologist or trichologist can assess your hair loss stage, order the right blood panel, and prescribe or recommend the appropriate combination protocol for your specific pattern and history. Do not let the first step be a supplement from a shelf. Let it be an accurate diagnosis. Second, stop spending on biotin and castor oil. That money belongs in a proven protocol. Minoxidil, professional microneedling sessions, or a medical consultation, not in marketing. Third, take a photograph of your hairline today, right now. Same lighting, same distance, front and top. This is your clinical baseline. Hair restoration is slow enough that without comparison photos, you will underestimate your progress and potentially quit before the treatment has had time to work. Fourth, subscribe to Daily Health Classroom. We are building the health education resource that your doctor wishes you had come in with. Every week, one topic. The ones that actually affect your quality of life, broken down the way a clinician explains it to a patient they care about. If this video gave you clarity that the internet hasn't, share it right now. Your friend who is 2 years into a castor oil routine needs to hear this. Your partner who is quietly watching their part get whiter and saying nothing needs this information. The window for hairline recovery is open right now. The question is whether you're going to act on it with the right information. I'll see you in the next class.